Hi, and welcome to our channel. Before we start, I kindly ask you to give us a like and subscribe to our channel. It doesn't cost you anything, but it's a great help for the channel to be considered well by YouTube. Thanks for the attention. Ever wondered why some people lose their hair earlier than others? It might be alopecia. Alopecia, in its simplest terms, is the medical term for hair loss, but it's so much more than that. It can occur in many forms and vary in severity, from small coin-sized patches of hair loss that regrow over time, to complete loss of all body hair. The hair on our heads is more than just a style statement. It's a part of our identity, a symbol of health and vitality. So, imagine the shock and distress experienced by those who find their hair thinning or falling out in clumps. But it's important to remember that alopecia is not a rare occurrence. It affects millions of people worldwide, crossing all age groups, genders, and ethnicities. Alopecia is not a disease, but rather a sign that something is going off track within your body. It's a condition that arises due to the disruption in the cycle of hair growth. Normally, our hair grows, rests, and then sheds. But in alopecia, the growth phase is often cut short. Hair follicles shrink, producing thinner, shorter hairs until eventually they become dormant and stop producing hair altogether. But why does this happen? Well, it's often due to a mix of genetics and environmental factors. For some, it's an autoimmune response, where the body mistakenly attacks its own hair follicles. For others, it could be due to hormonal imbalances, stress, or even certain medical treatments. But here's the thing. Alopecia is more than just a physical condition. The psychological impact of losing one's hair can be significant, affecting self-confidence and mental well-being. It's not just about vanity, it's about identity. So while alopecia is largely a cosmetic concern and not life-threatening, it's important to acknowledge its psychological impact. It's not just about losing hair, it's about losing a part of oneself. Alopecia is not just a cosmetic concern, it can affect anyone and has a profound impact on one's self-esteem. How can you identify alopecia? Let's dive in. Alopecia, as we know, is a condition characterized by abnormal hair loss. But what does this look like in its early stages? The first signs you might notice are a general thinning of your hair, or more hair than usual coming out when you comb or wash it. As the condition progresses, you may start to see bald patches appearing. These can be small and easy to hide at first, but they tend to grow over time. Another sign of alopecia can be hair that breaks easily. This is because alopecia affects the strength of the hair follicles, making them brittle. It's important to mention that everyone loses hair daily, but alopecia involves more substantial and noticeable loss. Recognizing these signs early on is key. Why? Because the sooner you identify the issue, the better you can manage it. Remember, noticing these signs early can make a significant difference. What happens in your body when you have alopecia? It's more than just hair falling out. Let's delve into the science behind alopecia to understand this better. Alopecia is the result of a complex interplay between genetics, hormones, and the immune system. The hair growth cycle, which usually involves growth, rest, and shedding phases, becomes disrupted. In the case of alopecia, the hair follicles, which are tiny structures in the skin that produce hair, become the target. These follicles go through a process known as miniaturization. This means they become smaller over time, leading to thinner, shorter, and weaker hairs. Eventually, these miniaturized follicles may stop producing hair altogether, resulting in bald patches. But why do these follicles shrink? The exact cause can vary, but it often involves an immune response. In conditions like alopecia areata, the immune system mistakenly attacks the hair follicles, causing inflammation. This inflammation can damage the follicles and disrupt hair growth. Hormones also play a crucial role. For instance, in androgenetic alopecia, which is the most common form of hair loss, male hormones called androgens influence the hair growth cycle. They can cause hair follicles to shrink and shorten the growth phase of hair. This results in thinner hairs that fall out more quickly. It's also worth noting that the impact of these factors can be influenced by your genes. Certain genetic variations can make you more susceptible to alopecia. It's a complex interplay, and researchers are still unraveling the precise mechanisms. In conclusion, alopecia is more than just hair falling out. It's a condition where your hair follicles shrink and weaken, disrupting the normal hair growth cycle. It's the result of various factors, including an immune response, hormonal influences, and genetic predisposition. Understanding the science behind alopecia can help you better manage the condition. What causes alopecia? The answer might surprise you. As we delve into this topic, it's important to understand that alopecia isn't caused by one single factor. It's typically a combination of several triggers, and these can vary from person to person. Let's start with stress. It's a common trigger for many health conditions, and alopecia is no different. When we're stressed, our bodies produce more cortisol, a hormone that can disrupt the growth cycle of hair follicles. Prolonged periods of stress can lead to significant hair loss, a condition known as telogen effluvium. Next up, hormonal imbalances. Our hormones play a crucial role in maintaining healthy hair growth. Imbalances, particularly in hormones like estrogen and testosterone, can lead to both hair thinning and loss. Conditions such as polycystic ovary syndrome or PCOS, which cause hormonal imbalances, often have alopecia as a symptom. Poor nutrition is another trigger. Our hair needs a variety of nutrients to grow and remain healthy. Deficiencies in vitamins and minerals, particularly iron, vitamin D, and B vitamins, can lead to hair loss. So, a balanced diet plays a crucial role in maintaining healthy hair. Lastly, let's talk about genetics. Androgenetic alopecia, also known as male or female pattern baldness, is the most common type of hair loss. It's largely determined by our genes. If you have a family history of alopecia, you may be more likely to develop it. Now, it's important to remember that while these triggers can lead to alopecia, they're not a guarantee that you'll develop the condition. Everyone is unique, and so is their hair loss journey. It's also worth noting that understanding these triggers is just the first step. If you suspect you might be experiencing alopecia, it's vital to consult with a healthcare professional for a proper diagnosis and treatment plan. Recognizing these triggers can help you reduce your risk of developing alopecia. Remember, knowledge is power. If we know what might cause alopecia, we're better equipped to take steps to prevent it or manage it effectively if it does occur. Alopecia can seem daunting, but there are ways to manage it. Now, we've all heard the adage that knowledge is power, and in the case of alopecia, it's absolutely true. Understanding your condition can empower you to take the right steps towards managing it. First and foremost, it's crucial to consult a trusted healthcare provider. They can provide an accurate diagnosis and shed light on the type of alopecia you're dealing with. This could be anything from alopecia areata, which causes patchy hair loss, to androgenetic alopecia, a common form of hair thinning in both men and women. Once your healthcare provider has identified the type of alopecia, they can help devise a personalized treatment plan. This plan could include a variety of approaches, depending on the severity and type of your alopecia. Medication is often the first line of defense. There are topical treatments like minoxidil or oral medications like finasteride, which work by stimulating hair growth or slowing hair loss. But remember, these treatments don't work overnight. Patience and consistency are key. For some, laser therapy may be a viable option. This treatment uses low-level lasers to stimulate hair follicles, promoting growth. It's a relatively new approach, but has shown promising results for some individuals. In more severe cases, or when other treatments haven't worked, hair transplants might be considered. This involves moving hair from a fuller part of the scalp to a thinning or bald area. It's a more invasive approach, and like any surgical procedure, it comes with its own risks and considerations. But what's most important is that you don't lose hope. Yes, alopecia can be challenging, but with the right help and approach, it can be managed. Each person's journey with alopecia is unique, and so too will be their treatment plan. So take heart, reach out to healthcare professionals, explore your options, and remember, with the right help and approach, you can manage alopecia effectively. Alopecia doesn't just affect your hair, it can also affect your mind. The psychological impact of this condition is often overlooked, yet it plays a significant role in the overall well-being of those diagnosed. The sudden change in appearance can lead to feelings of embarrassment, anxiety, and even depression. The mirror no longer reflects the familiar, and this can be deeply unsettling. It's important to remember that it's normal to feel these emotions. However, emotions don't have to rule us. There is power in support, in understanding, and in conversation. Friends, family, therapists, they can all provide a safe space for expressing these feelings. They can help to navigate through the storm of self-doubt and emerge stronger on the other side. No one should have to face alopecia alone. Remember, you're not alone. Reach out to your loved ones or a support group if you're struggling with alopecia. Sharing is caring, and that's especially true when it comes to health information. So let's help spread the word about alopecia. We've learned today that it's a condition that affects many people worldwide, but with knowledge, support, and the right treatment, it can be managed effectively. If you found this video helpful, we encourage you to share it with anyone who might benefit from its content. It could be a friend, a family member, or even a colleague. By doing so, you're not just sharing a video, you're also spreading awareness and potentially helping someone else recognize the symptoms early. Don't forget to hit the like button if you found this video informative. Your likes help us reach more people and increase awareness about important health topics like alopecia. Also, make sure to subscribe to our channel Rapid Quest Health for more videos on health and well-being. Keep learning, keep sharing, and together we can make a difference in the world of health.